Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning,
Are
Anita.
you the Andy, Dr. Andy Mencia I hear so much about? Are you really him sitting here in this chair?
The
You a
one
fake?
and only.
Are you a fake sitting here? You're his zombie brother?
May the real Andy Mencia please stand up.
Yeah. I don't know how you get, you are an amazing man. You work all the time at your centers, and yet you're here bright and early on Saturday morning.
I look
with this.
forward to Saturday.
I do too, but you have this gorgeous face. You're so smiley, and then, of course, Ina is here watching over to make sure.
Good morning.
To make sure that you don't,
Dobre
pardon the
utra.
expression, screw up.
Guten Morgen. Guten Morgen.
But it is a great pleasure, and you just absolutely love what you do so much.
I
Don't
love
you?
what I do. I love what I do. I'm very happy. So as you heard in Europe, Germany will be taking.
I was so impressed with Merkel. I was so impressed that she stood up there and said, "We're going to take them," and then everybody's following suit.
Good.
I love that. And, here we get, I'm not going to get into politics. The United States, all of a sudden, they start, meow, 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 meow. But here, the humanity
when Hitler was killing the Jewish in Germany, United States also was, if you remember the history.
Same way.
They were doing the same thing.
Amazing.
And it took a small country like Dominican Republic to say, okay, we'll take the Jews, send it to us. For them to say, wait a second, we better do something here because Dominican Republic, Cuba, then Argentina, France, and then the United States said, okay, we better join the rank.
Yeah, I was very proud of her, Merkel, when she did that, and then in England. And when you see it, because these are refugees.
Well, once they do that, then they will distribute to the Union, the European Union.
Well, I heard something. I heard on and I know that we should be talking about medical, but I'll just say this because it does make sense. That Germany's losing a lot of their, a lot of older people are there, and they know they're going to die. And they said, here's a whole new group of young people that we're going to be able to have in our society.
Right,
so it was done in a practical way also, as well as humanity.
Right.
It's very smart.
That's correct.
Okay, so let's talk about, in fact, I'm glad that you came in this morning. You want to talk about...
That was a good topic. Well, that was a good topic that you just discussed about Alzheimer's disease. And, we are going to be involved in a study it's going to be sponsored by Medicare, so therefore they're going to pay for most of the tests. But we're going to be involved in a study on mild cognitive impairment, which is the condition that most people will get before they develop dementia or any other form of dementia like Alzheimer. Alzheimer is only one of the type of dementia that we have. And when people have mild cognitive impairment or dementia, that's why it's good to have a person have my training, a geriatrician, or a neurologist, or a psychiatrist with training on a mild cognitive impairment of dementia to do an evaluation for you. The reason being is that in geriatric medicine, when we are fellowship trained like myself, is our specialty. Is what, after we become an internist or a family practitioner, then you go for extra training, just like a cardiologist will become first a internist or do a year of internship or become an internist and then become a cardiologist, do the extra training to get that specialty. So with geriatric medicine, the statistics show that we are 95% certain of the condition when you have been seen by a geriatrician, by a neurologist. And in my case, we have both players in the center. We have the neurologist and you have me. You have Dr. Pham also, that is a geriatrician. So you have fully trained geriatrician doing this. And then when you look for a geriatrician as a consumer, you want to know if the person grandfather into geriatric medicine, did the person grandfather in, or did the person train? because what happened because of the high deficit, geriatric medicine started in England, the specialty. It didn't start in the United States, it started in England. And then the United States followed through. And therefore, we have a huge deficit of geriatrician. Such a huge deficit that in my time when I trained, it was a 2-year fellowship training program. Nowadays, trying to get more geriatrician now, it's only 1-year fellowship training program. So you only do a 1 year.
But Dr. Mencia, I heard the reason. This is very, and when I was getting my gerontology degree, I also, we were discussing about doctors and why more doctors, MDs, didn't have that training. And the discussion was that a lot of the young doctors coming, they wanted to deal with people who they felt could get better. But they said they deal with an older person, they're just going to die. I mean, I heard this, I almost fell over.
Yes. Yeah,
and that was a problem, wasn't it?
That was one of the main problems.
Statement.
Yeah. Right. They were playing God, basically discriminating. Say, it's called, just like when we say, I'm not going to see blacks in my office, or I'm not going to see women. So that would be racial discrimination and sex discrimination. When you discriminate against the aging, it's called ageism. Okay, it's a form of discrimination. And I just had my student from Nova University rotating with us. And he said, wow, I'm so impressed. Even though I came to do a geriatric rotation, you even see kids coming in here. So, and we cannot discriminate a person by their age.
No, but it's, they just didn't see the hope in it. But so that's why I was so glad when I met you and your attitude. But I want to just ask you a question, because you said we were going to talk about hypertension. If people have hypertension, would that, no, stupid question, I know. I'll just say it anyway.
Say me, stupid question.
Would that lead to Alzheimer's? Would that lead to dementia in any way? Because as their blood pressure goes high?
Absolutely, yes. Person with uncontrolled, not just having high blood pressure, but uncontrolled hypertension. It's a big difference.
What's the difference?
Well, the main difference is a person with high blood pressure. Let's say your blood pressure is 180 over 100, and you get put on medication, and it dropped down to 160 over 80. You still have the blood pressure is above the recommendation. But let's say you keep it constant at that level. That person has less risk of producing damage to the brain than a person that forget to take the medication for 3 days, then take it again, then they forget for another 2 days, they take it again, they skip for a week, they take it again. During the moment of not having any medication to cover you, you're going to have a rebound on your blood pressure. It's going to shoot up again. You won't feel anything. That's what we call hypertension, the silent killer. But you're going to have a rebound on that blood pressure. It's going to shoot up to, again, maybe 180, 190, 170. And those peaks is what produce the damage. It's not the constant blood pressure. There are many people that say, well, but I live with high blood pressure for so long, I never have any problem. But whatever you are doing, you keep in a control. You are not, the peaks are the one that really affect you, just like diabetes. If you have your sugar control, ideally we want to bring it down below 100. But if you keep a control at 110 and you never shoot to 140, 160, and you just keep it at 110, you're living almost like a non-diabetic person. So even though you have the ideal situation, then you have the practical situation. And I like to be practical. And the reason being is look back at history. The recommendation right now for blood pressure is still the top number. It should be 140 to 150. Okay? The new study that they just concluded, they terminate the study early from Friday. It's going to be published. It's going to come in a journal for all physicians to then read. But there was an article on Friday in the New York Times that this study also sponsored by the federal government was looking, and it was a professor from Harvard University that was involved in this, the leader, a specialist in high blood pressure. They were looking at two groups to see, are we right by saying 140, the top number, is that the right number, or should we bring it down to 120? So they took patients above the age of 50 and up, so baby boomers, and the goal was for the doctor to do whatever you have to do to bring that blood pressure below 120 in one group, and the other group follow the regular standard, what we have today, or below 140 or below. And they had to stop the study because they noticed thus far in the study that the patient with the blood pressure below 120, they have less heart attack, less congestive heart failure, and less strokes. So, that was significant that they had to stop the study. So as I review the article that came in the New York Times, then I'm not going to jump and start dropping the blood pressure on all my patients, because, there's one thing that you always have to do before you go running to a doctor. For those of you that's, going to go into the New York Times and read this article. Elderly patient has a tendency of, when they stand up, their blood pressure dropping. And it's called orthostatic hypotension, which means that you can have a blood pressure, let's say 130, and you stand up and it dropped to 120. So if you drop it now to 120 and you stand up and it dropped to 90, and you start feeling, woo, the room spinning on you, or you feel lightheaded inside. Yes. So we have to be very cautious how we jump. And I'm not the one to take my patient and like a guinea pig and say, oh, the number changed, I'm going to have to give more blood pressure medication to all of my patients. No, let's take it easy. Let's see. Let's read the study. How was the study designed? Did we check for orthostatic hypertension? The other thing is one of the inclusion criteria, which is one of the points that we look at to bring people into the study, was that you were at high risk of congestive heart failure, heart attack, or kidney failure. Well, what about the patients that don't have those risks? They were not included in the study. And, when you include people that you know are very high risk, the result cannot be extrapolated to the regular population. And that's why we have to be very cautious. And as a geriatrician, patient come to me and say, oh, but I went to my doctor and they say my sugar was fine. Yesterday I had a patient like that. And I look at the blood test from the doctor that she was having, and the blood sugar was 98. I say, well, you are within range, but to be honest with you, your toes are touching the fence of pre-diabetes. And she goes, but why? Isn't it normal, 98? I say, yeah, 99 is abnormal already. So you are 1 point away from being abnormal. Are you happy with that? Are you comfortable with that? He goes, no. I say, okay, so we have to work on your sugar. Let's do the hemoglobin A1C. We did the test, and lo and behold, hemoglobin A1C was higher than normal. So I said, when you went for that test, of course, you fasted, didn't eat anything. Maybe you have your dinner quite early. She said, yeah, I eat around 4:35. There you go. So you didn't eat anything until the next day. And when was the blood test done? She said, around 10 o'clock. I said, you went for many hours without eating. That's why your sugar at that point in time was in the normal range. But if he would have looked at your hemoglobin A1C, he would have detected that you are already a pre-diabetic. She goes, no, am I? I say, yeah, but there's good news.
Because now you can do something about it, right?
Exactly. I say, now we're going to do preventive medicine. I say, young lady, she's 64,
I love Dr. Mencia, young lady in 60s. Isn't that great? That's how we look.
Yeah.
Gets all these
Because,
80 and 90-year-olds, right?
Because, I hate to see people that, she still work, for, I think it's Spirit Airline or something. So she's flying all over. And I say, the good thing is that we can fix your diet so that you can control your sugar without medication. You don't need to take medication. And
see, so stop. I love that. That's the whole point. It's the same thing when my blood pressure was a little high and you got on magnesium and I got on what are those little seeds you told me to have, the little
the flax
seeds. And all of a sudden it's been holding at 140. I mean, and so many, medical personnel want you to start on pharmaceuticals.
Right.
And you always try first to do it the natural way. And that's
Absolutely.
what makes you.
I have one of my rabbi that come in and he does so well with garlic. He lost weight and he eats a lot of garlic and he like natural stuff. So I say, get natural garlic then, don't go for no capsule, none of that stuff. Just go for the real thing. And, his blood pressure is great. And he's always traveling. He just bought a place in Las Vegas that he liked to go to Las Vegas. And, and that's preventive medicine. That's what I love.
I know you do.
I love to prevent.
Let's go into that hypertension. When you start now, let's go into that. Talk about the difference in the higher, and what is it doing inside you as it gets higher, if it gets low? Talk about the body inside.
Well, in hypertension, when we look at blood pressure, we look at two numbers. The systolic, which is the top number, and the diastolic. So for pencil talk follower, just put S and D. S on top of the D. So the systolic blood pressure is when the heart contracts. Every time you hear your heart pump, or if you check your pulse and you get that pulse hitting your finger, and the best place to check your pulse is right by your neck, in the front, but on front lateral. So on the side of the neck toward the front, and you feel the pulsation hitting you. It's a big artery that goes through there. It's the one that we look at when we're looking for plaques going to the brain or anything like that. So it's a very important artery for preventive medicine. So that pulse, that kicking that you get on your finger is from the systolic portion of blood pressure. When you don't get that kick, that's the diastolic. So systolic is when the heart is contracted, and diastolic is when the heart relaxes. Now, let's time it. The systolic is very fast. So it's peak and drop. Now, when we look at the peak and time it versus the resting point, your heart spends 2/3 of the time resting. 1/3 of its time, of its lifetime, the heart is pumping on systolic. It's on the top number, 1/3 of the time. And 2/3 of the time is on the diastolic number. So if you're checking your blood pressure, and let's say your top number is 120, 118, that's beautiful. But if your bottom number is 91, 94, 91, 94, that means your blood pressure 2/3 of the time you are pushing, against your brain, you are pushing against your heart, the blood vessel inside your heart, because the heart, remember, is a chamber, but it is made out of muscle. So, when they say they put a stent on me, they didn't put it inside your heart, they put it on the outer part of the heart, because there are blood vessels that go to the heart. So it can feed blood to those muscles so that it can continue to function. So when one of those blood vessels shut down, that's when people get those either silent heart attack if it's a small blood vessel, or a major heart attack if it's a main artery that collapses on you. So most of the time we spend the time in the diastolic number. So that number is important. Many people say, I don't care about the bottom number, just give me the top number. Now that number become important because we spend 2/3 of our time on diastolic. So you want that number to be below 80, and it's acceptable to be slightly above 80. It's okay, but you don't want it to go 90 or higher on that number, regardless what the top number is, because of the fact that we know our heart spend most of the time at, or our system, the circulatory system spend most of the time in relaxation. Then only 1/3 of the time is on contraction.
Okay, so wait, now I have to ask you a question about this. So now, if you're running around, you're doing a lot of things, is that not going to make everything higher?
Okay, so a lot of people go and they run to either, in my office, we try to make sure the patient don't sit and waste their time, so we're trying to get them in. And where they are anxious or where they are under a lot of stress, I have one of the BP or one of the bank when he come in, he's under so much stress that when I go in, I say, don't get his blood pressure. And I sit down with him, and we sit down and we talk, and he loves horses like me, and he like animals, he had cats and what have you. So we talk about a little bit the thing that he loves, that he likes to do, that is not work related. And sometimes I ask, how's your work doing? But with him, it's the other way around. We don't want to talk about work. You want to talk about something different. So, and it's the kind of thing you want to do at home. If you're going to sit down with your spouse or your brother or sister that is going to check your blood pressure, if you're going to do it yourself, try to think of something pleasant. Know what is stressing you out. I forgot to pay the rent. I had to go and do the check. Go and do what you have to do, and then come and check your blood pressure. So stress will definitely raise your blood pressure.
Why? Talk about that. Why does it do that?
Because your body doesn't understand why you're being stressed out. You can be stressed out because you're going out for dinner. Inside your body, what the body understands, you start releasing all this chemical as if somebody's following you with a gun or a knife. The body is called the fight or flight situation. So whenever you put your body to stress, regardless of what the source is, whether it is that I'm stressful because I'm going to talk on the radio, I'm stressful because I'm going to see the President of the United States as a patient, I'm stressful because I'm going to speak before a big audience. Whatever is producing the stress on you, the body doesn't know that. All the body knows is I'm under stress. And to the body, it goes into this fight or flight mode. And the moment it goes into that is, imagine somebody's going to chase you with a knife. You start getting palpitation. The heart is getting ready. The whole body is getting ready to start running in order to save your life. That's how the body responds. So when you put yourself under unnecessary stress, that's what you're doing to your body. And when you don't pay attention to stress, that's what the body, that's how it responds. And if you ask me, to me, that's the root of so many problems that we have. And so many things that we see, including, Alzheimer, Parkinson, bipolar, hypertension, kidney disease. Stress plays such a big component, because a person that lives under a lot of stress and they don't do anything to relax it, get rid of it or control it, it will have consequences, because your body wasn't meant for that.
Okay, and I don't want to run out of time before I ask you another question. How about weight? If you lose weight, does that also help you get your blood pressure down?
After stress release, then weight control. There are many people that are overweight and they have beautiful blood pressure. So weight doesn't necessarily mean high blood pressure. There are many people with that they are overweight, but their sugar is completely normal. So being obese doesn't necessarily mean that. And there are many people that are overweight that their cholesterol is excellent. So, which tell us as physicians, there's a lot for us to learn. We still training people with a traditional way of taking care of patients. We need to start training people in the holistic and traditional. We need to start merging these two systems, and which is what I've been doing for the past 20 years in practice. Merging more and more, learning more and more about holistic, and keeping abreast with what's going on in tradition. And then I sit like a bodyguard to my patient, okay? Because a study come out and they say, oh, take this medication, or do this to the patient, or lower the blood pressure here, do this, bring it there. Well, look at the whole body, look at the whole individual. Look at the whole situation. I said, do I want to be that aggressive? And we forgot to give the phone number.
I know we do. And I have so many questions to you. I want to talk about Tai Chi, and now we're going to lower our blood pressure.
Oh, that's beautiful.
I know. I'd like to continue maybe this in the next week that we keep talking about it. Phone number to go there and see Dr. Mencia. If you have any blood pressure problems at all, go there, because he's the kind of doctor that will really help you without pushing you on medication. He will tell you so many things. The phone number in Fort Lauderdale is 954-489-1345. That's 954-489-1345. And home visit services are available, which is unique for a medical practice. It's wonderful they do that. And also their website is AGI for Adult Geriatric Institute. That's AGIFL.com. AGIFL.com. And Boynton Beach, is it open?
It's open today.
It's open today.
Both dental department are open.
Oh my gosh, I can't believe it. So that number
Those
over there.
Those copycats, they say, Mencia is doing it, we're going to do it too.
561-270-6494. You can always go to their website and it'll tell you everything. AGIFL.com. Dr. Mencia, the half an hour goes so quickly, and I have so many questions yet to talk to you about.
Oh, it's always a pleasure.
But I thank you, because you really have helped me with my blood pressure, and I am on all these natural things, and so I do appreciate that so much.
And I'm going to be on the symposium.
Yes, we have to talk about that. That's right, we will be. And I have mentioned that before, that Dr. Mencia will be one of our stars at our symposium. So that's on Saturday, October 24th. Over there at Palm Beach State College in Boca Raton, and we'll be talking more about that.
And I'm going to be in the afternoon program.
Yes.
So for those people that come,
right, the afternoon, so you can still go see him in the morning, and then the afternoon. That's right. I think we have you set at 1 or 1:30. I'm not sure, but we'll
and
let
those people
know.
that have not been to the symposium to see you and I, tell them to just jot down what they think will look like.
Oh,
and then to drop it to you.
Okay. Okay.
I have heard so many things.
Thank you so much.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.